Hey, it's good to see you and welcome to another video. In this video, we will explore the most common causes of foot pain in growing children, from flat feet to Sever's disease. We'll demystify the whole thing and give you a better understanding of what might be going on with your child's feet. And hey, we won't stop there. We'll also explore a range of possible treatments that can bring some much-needed relief to those tiny tootsies. In this video, we will cover flat feet, Sever's disease, growing pains, Achilles tendonitis, ingrown toenails, sprained ankles, plantar fasciitis, plantar warts, and juvenile idiopathic arthritis. So let's get started. Flat feet, also known as fallen arches, is a condition where the arches on the inside of the feet are flattened, causing the entire sole of the foot to touch the ground. It's actually quite common in growing children, and while it's often painless, it can lead to certain symptoms worth paying attention to. So, what are the telltale signs of flat feet? Well, keep an eye out for things like pain or tenderness along the inner side of the foot, especially when walking or standing for long periods. Your child may also experience swelling or stiffness in the foot or ankle. Another common symptom is an inward rolling of the ankles, known as overpronation. This can affect the alignment of the legs and cause discomfort in the knees, hips, or lower back. It's important to note that not all children with flat feet experience symptoms. Treatment for flat feet in children typically focuses on managing any associated symptoms. This may include using arch supports or orthotic devices to provide additional support and alleviate discomfort. Physical therapy exercises can also help strengthen the feet and improve alignment. Sever's disease is a common condition affecting growing children. Also known as calcaneal apophysitis, it occurs when the growth plate at the back of the heel becomes inflamed. This condition often arises during periods of rapid growth and high physical activity levels. So, what are the typical symptoms to watch out for? Look for heel pain, especially during or after physical activities like running or jumping. Swelling and tenderness around the heel area may also be present. The treatment for Sever's disease aims to relieve pain and promote healing. Initially, it may involve rest and reducing or modifying activities that aggravate the condition. Applying ice packs to the affected area can help alleviate pain and reduce inflammation of the growth plate. Stretching exercises for the calf muscles and Achilles tendon may also be recommended. In some cases, orthotic shoe inserts or heel cups can provide additional support. Non-steroidal anti-inflammatory drugs may be used to manage pain and inflammation. With proper care and adherence to the treatment plan, most children with Sever's disease can recover fully and return to their normal activities. Growing pains, the fascinating, yet sometimes perplexing experience that can cause foot pain in our little ones. Believe it or not, one of the most benign reasons for children to experience foot pain stems from the natural process of growing up. As their bodies rapidly change and muscles stretch and develop, some cramping and discomfort can occur. Growing pains are often described as intermittent aches or soreness in the legs, including the feet. They typically occur during periods of rapid growth, most commonly in preschool and early school-aged children. The pain tends to be more prominent in the evening or at night, and it often resolves on its own. While growing pains can be unsettling, rest assured that they are generally harmless and temporary. Providing gentle massage to sore muscles, warmth, or over-the-counter pain relievers may offer some relief for your little one. However, if the pain becomes persistent or significantly affects your child's daily activities, it's always a good idea to consult your child's doctor to ensure an accurate diagnosis and appropriate care. When it comes to the Achilles tendon, a crucial structure in the back of the ankle that connects the calf muscle to the heel bone, various conditions can lead to pain and discomfort. Let's explore a few potential culprits. Achilles tendonitis. This condition occurs when the Achilles tendon becomes inflamed due to overuse, repetitive stress, improper footwear, or sudden increase in physical activity. It can cause pain, swelling, and stiffness in the back of the ankle. Achilles tendon rupture. A partial or complete tear of the Achilles tendon can result from forceful movements or sudden trauma. This injury often causes severe pain, swelling, difficulty walking, and a popping sound at the time of injury. Achilles tendinosis. Unlike tendinitis, tendinosis refers to a degenerative condition where the Achilles tendon undergoes microscopic damage and fails to heal properly. It can lead to chronic pain and weakness in the ankle. Achilles bursitis. Inflammation of the bursae, which are small fluid-filled sacs, located near the Achilles tendon, can cause pain and swelling. Bursitis often occur due to repetitive friction or pressure on the area. The specific treatment for Achilles tendon conditions depends on the diagnosis and severity of the condition. In general, initial treatment may involve rest, ice, compression, and elevation to reduce pain and inflammation. Physical therapy exercises focusing on stretching and strengthening the calf muscles can help with healing and prevention of future injuries. Orthotic devices or footwear modifications may be recommended to provide support and alleviate stress on the Achilles tendon. In more severe cases, immobilization with a cast or walking boot might be necessary. Surgical intervention may be considered for Achilles tendon ruptures or chronic conditions that do not respond to conservative treatments. An ingrown toenail in children occurs when the edge of the toenail grows into the surrounding skin instead of straight out and most commonly affects the big toe. This condition can cause pain, swelling, redness, and tenderness in the affected toe. Ingrown toenails in young children are often a result of improper nail trimming, tight-fitting shoes, or injury. In some cases, the area may become infected, leading to additional symptoms like pus or drainage. Treatment options for ingrown toenails in children may include soaking the foot in warm water, wearing open-toed shoes, gently lifting the nail, or, in severe cases, surgical intervention by a healthcare professional to remove a portion of the nail or the entire nail bed. A sprained ankle is a common injury in children that occurs when the ligaments surrounding the ankle joint are stretched or torn. This usually happens due to a sudden twisting or rolling motion of the foot, resulting in pain and discomfort. Symptoms of a sprained ankle in children may include immediate pain at the time of injury, swelling, bruising, tenderness to touch, difficulty walking or bearing weight on the affected ankle, and stiffness or limited range of motion. It's important to note that the severity of a sprained ankle can vary, ranging from mild to severe. In mild cases, there may be minimal swelling and discomfort, while in severe cases, there can be significant pain, swelling, and instability of the joint. Immediate treatment for a sprained ankle in children involves the Rice method: rest, ice, compression, and elevation. Resting the ankle. Applying an ice pack to reduce swelling, using compression bandages to support the joint, and elevating the leg can help alleviate pain and promote healing. It's advisable to seek medical attention for a physical examination, proper diagnosis and guidance on specific treatment options, which may include physical therapy exercises. Plantar fasciitis, although commonly associated with adults, can also affect children. It is a condition characterized by inflammation and irritation of the plantar fascia, a thick band of tissue that runs along the bottom of the foot. When the plantar fascia becomes strained or overstretched, it can lead to pain and discomfort, especially in the heel area. In active children, plantar fasciitis often occurs due to activities that involve repetitive stress on the feet and heel bone, such as running, jumping, or participating in sports. Rapid growth spurts can also contribute to the development of this condition. Symptoms of plantar fasciitis in children include heel pain, particularly upon waking up or after periods of rest, as well as pain that worsens with physical activity. The affected heel may feel tender to touch, and children may exhibit a limp or change in their walking pattern to avoid putting pressure on the painful area. Treatment for plantar fasciitis in children typically involves a combination of rest, ice packs, stretching exercises, and supportive footwear. Physical therapy may be recommended to strengthen the foot muscles and improve flexibility. In some cases, custom orthotics or night splints may be used to provide additional support and alleviate symptoms. Plantar warts are noncancerous growths that develop on the soles of the feet and are very common in children. They are caused by the human papillomavirus, entering the skin through small cuts or breaks. Plantar warts often appear as small, grainy lesions with a rough texture, and may have tiny black dots known as wart seeds. Children are particularly susceptible to plantar warts. Common reasons as to why children develop plantar warts are due to their developing immune systems and frequent exposure to communal areas like swimming pools and locker rooms. These warts can be painful, especially when pressure is applied, such as when walking or standing. Treating plantar warts in children typically involves over-the-counter wart treatments containing salicylic acid. These medications gradually dissolve the wart over time. It's important to follow the instructions carefully and protect healthy skin surrounding the wart. In stubborn cases, a healthcare professional may recommend other treatments like freezing the wart, laser therapy, or minor surgical removal. Prevention is key to avoiding plantar warts. Encouraging children to wear flip-flops or water shoes in public showers or pools and maintaining good foot hygiene can help reduce the risk of contracting the virus. Juvenile idiopathic arthritis is an autoimmune condition characterized by inflammation in the joints of children and adolescents. It is the most common type of arthritis in children under the age of 16 and is of unknown cause. Juvenile idiopathic arthritis affects the synovial lining of the joints, leading to pain, swelling, stiffness, and reduced mobility. The symptoms of juvenile idiopathic arthritis can vary widely from mild to severe and may come and go over time. Some children experience a single joint being affected, such as the ankle or hip, while others may have multiple joints involved. Along with joint symptoms, juvenile idiopathic arthritis can also cause fatigue, fever, rash, and eye inflammation. The exact cause remains unknown, but it is believed to involve a combination of genetic predisposition and environmental factors. Early diagnosis is crucial to prevent joint damage and manage symptoms effectively. This may include a combination of physical examination and blood tests. Treatment approaches for juvenile idiopathic arthritis may include a combination of medication, physical therapy, occupational therapy, and regular follow-up with your child's doctor or a rheumatologist. With proper management and support, most children with juvenile idiopathic arthritis can lead active and fulfilling lives.